I'll tell you the truth,
Yeah.
right? Kenya has one of the most progressive policies around digital health. They understand the core of digital health.
Yeah.
And they've been engaging, okay? One of the first things when I saw that I liked is the fact that to do a telehealth company, you needed to be a level 2 hospital. I think that made sense because at some point, somebody needs to have some level of responsibility. I think the engagement around the digital superhighway in terms of data interoperability, these things, conversations ongoing, and very important conversation.
And then, depending on the method you use, the patient could be skeptical of the results. Think about you doing a HIV test and sending it on text message that you are HIV positive. You can be sued for that. That is negligence. So there are proper ways to deliver the information. Again, the doctors have, as much as we are using telehealth, there is a level of assessment that this now requires a physical consultation for us to have a one-on-one talk and understand these things. So the issues of resistance, it's a matter of awareness and explaining things for the patients to understand.
Yeah.
But the biggest resistance is not in terms of those policies. It's in terms of
The patient.
Anthony's colleagues
It's the doctors.
who believe
Yes.
that telemedicine is here to replace them, right? There are medical practitioners
Yeah.
who do not believe that digital calendars should schedule their appointments, right? They are old school.
The old school. They want a physical.
They want a physical this. They don't believe in a lot of these things around digital health. And it's understood that we need to keep engaging, right? Those are people that we need to win over because health is a trust-based issue. And one of the things that you would end up understanding is that the average person wants to be touched, wants a doctor to touch and feel.